Okay, Mr. Jones. So we have your audiogram results back. So we understand that you have been in construction, working for, good 20 years of your life. And so, which would explain the results. And so if you see, these are your air or your bone. And so this is what's going on inside your inner ear. And then we have your air components of your ear. And this is where we're seeing the hearing loss. And so this is in a notch configuration, which is really common for noise-induced hearing loss, which we're attributing your hearing loss to because of your work. And so you've said you've experienced ringing and having problems hearing high frequencies, such as your girlfriend's voice, talking on the phone. And high frequencies are associated with consonants, and so it's normal that you're not hearing those, a majority of speech, which are consonants. So with that, everything came back normal with your otoscopy. Um, so your word recognition scoring, again, especially in your left ear, which is your worst ear, in your right ear is your better ear. Those scores did come back to us normal because of your loss in the high frequency. So, like I said, it's understandable that you can't hear those consonants. So, what we have decided to do for you is we are finding that you are a candidate for hearing aids because of your motivation. You want to communicate better with your girlfriend and just being able to talk on the phone and continue with daily life. So we're going to just start with the left ear first, and because that is your lower hearing ear. And so what we're going to fit you with is a RIT, and that's going to be a receiver in the ear. So basically it's going to go behind your ear and then have a piece that goes inside your ear. So really that's going to boost up those high frequencies, and then you're still going to have room in the rest of your ear to hear what you can hear, and it's going to play on your residual hearing. So those low frequencies that you can still hear. Also, I recommend some assistive technology devices for you. Specifically, you mentioned having trouble communicating on the phone. So we're going to get that amplified phone. I recommend that you get an amplified phone, and that will boost up what is being said. And so it's basically just going to increase the volume for you. And then also, you mentioned your girlfriend and communicating with her and improving that. I recommend her getting a mic so that it speaks directly into your hearing aids, or the left one for now. And so that way she can directly speak to you. So like I said, your receiver in the ear is going to go behind your ear and also inside your ear. What we're going to do, I'm going to show you your hearing aid. And so there are 4 parts. There's the microphone, there's the receiver, there's the amplifier, and then there's the power source, which is going to be your battery. Okay. And I'm programming the hearing aid to a high frequency to boost up those high frequencies, since you can hear your low frequencies. So you do get a cleaning kit, and basically that comes with a brush and a wire loop, as well as wax traps that you can replace, and then also a dry aid kit, which basically if your hearing aid gets too moist or moisture affects it, you can put it in there, and overnight it will soak up the moisture. So really, it's really important that you are wearing your hearing aid consistently, because your wearing of the hearing aid is going to stimulate your brain and continue to give it stimuli so that it will hear. Hearing is not associated. We think it's associated with the ears, but it's associated with the brain. So the more you're exposing your brain to hearing, of especially those high frequencies wearing your hearing aid, then the more you're going to improve with it. So it's just a constant working through it. And then finally, so different things can go wrong throughout, and you're not always going to be at the doctor or an audiologist to help you. So there are a couple of, quick tips that I can tell you to kind of deal with these issues on your own. So if your aid is dead and it is not working, you want to for sure check the battery. So make sure it's inserted correctly. Make sure you have the right size, because there are different sizes for your hearing aid. And then also check if it's dead. So if your battery is dead. And then also, I mentioned those wax traps before. If those get clogged with wax, you can go ahead and take those off and replace those. And that, again, comes with your cleaning tool kit. All right? Are we good?
I think so. Sounds
awesome. Good. Are you excited?
Yeah.
Cool.
Thank you.